Hi everyone, I'm Lily, and I'm going to be giving my case study presentation on Alzheimer's disease. To begin with pathophysiology, a recent study published by the International Journal of Nanomedicine suggested that the presence of amyloid peptides in the brain is considered a major cause or potential cause of Alzheimer's disease. Essentially, the accumulation of these peptides in the brain form what are called senile plaques, and these plaques are what um, the study suggests are interfering with cognitive processes and causing some of the symptoms that we'll discuss later in the presentation. Um, Additionally, the concept of microglial infiltration is mentioned in reference to amyloid peptides. And essentially what that is once amyloid peptides are forming in the brain in excess, they lower the brain's immunoresponse to these peptides, and it makes it even easier for those peptides to infiltrate the brain and interfere with some of our neurological processes. A secondary cause suggested by this study was the presence of hyperphosphorylated tau proteins. And essentially what happens when these proteins are present is in the brain in excess is they can cause neurofibrillary tangles, or NFTs, in the cortical and limbic areas of the brain. And when that happens, they are interfering with our pre-established neural pathways and kind of distorting our former cognitive processes, and again, leading to some of the cognitive deficits that are considered a result of Alzheimer's disease. Moving into risk factors, some of the more heavily supported risk factors for Alzheimer's disease in research as of now are age, older age, and family history. Um, Currently in research, studies are looking more closely into the effects of education, diet, and environment on the development of Alzheimer's. And then there are a number of risk factors that are actually being disproven in research as of recently. These include aluminum, flu shots, and silver dental fillings, despite a heavy presence of myths that suggest that there's a link between um, use of these products in Alzheimer's disease. More recent research is suggesting that that's not the case and that those things are unrelated. In terms of symptoms and complications associated with Alzheimer's, of course, most commonly we find memory loss. Other symptoms and complications include repeating questions, poor judgment, struggles with daily tasks, frequently misplacing items, struggles with handling money, and mood and personality changes. Next up, some special considerations to keep in mind when caring for patients with Alzheimer's. The first of these is struggles with eating and diet. The cognitive and physical deficits that are associated with the development of Alzheimer's disease sometimes result in people having to change the way that they eat. Difficulties chewing and swallowing present challenges eating in a more traditional manner. And so sometimes patients are forced to give up the way that they used to enjoy certain foods, or they have to give up foods that they used to enjoy. And so it's important to remember that that can be emotionally frustrating or disappointing. Sundowning is another special consideration. This is the phenomenon that people with Alzheimer's have a change in demeanor based on a change in the time of day. Typically, when nightfall occurs, the people who are sundowning will become more irritated or aggressive, agitated. And so it's important to remember that that change in demeanor is not necessarily voluntary. And so caretakers should not hold that um, kind of devolution in personality and in character against patients with Alzheimer's, because it's not coming from a place of malicious intent. Hallucinations and delusions are a somewhat common result of middle and late stage Alzheimer's. Patients will see things or believe things that aren't really true or aren't really there. And it can be really disorienting for patients with Alzheimer's if caretakers aren't properly sympathetic when it comes to these experiences of hallucinations and delusions. And so it's important for caretakers to be mindful of how disorienting and scary it can be for patients with Alzheimer's to realize that they're kind of out of touch with reality. And related to that, to preserve patients with Alzheimer's physical safety, it's important to remember wandering and how that can be a side effect of hallucinations and delusions and just Alzheimer's in general. Patients might go looking for people that aren't really there, or they'll believe that they're somewhere that they aren't. And so it's important to keep patients under close supervision so as to ensure that they're not wandering into places that they're not supposed to be or places that aren't safe for them to be, as a result of this kind of miscommunication in their brain. Finally, in terms of prognosis and kind of the final manifestations of this disease, some of the late stage symptoms we see include loss of communication skills, weight loss, seizures, difficulty swallowing, increased sleeping, and loss of bowel and bladder control. And then one of the most common causes of death that we see in patients with Alzheimer's is aspiration pneumonia. This occurs when patients with Alzheimer's aspirate while eating or drinking, meaning that food or liquid enters their lungs, and then that food or liquid then becomes infected in the lungs and causes pneumonia, which is often fatal for people that suffer from Alzheimer's, and that becomes a major cause of death for many of these patients. As you can see, the final effects of this disease are truly devastating and very severe, and so that's definitely a reason why I so strongly feel that we should continue to support research on this topic so that as we progress towards a cure in this field, fewer and fewer people will have to go through these severe kind of final effects of this disease. And these are my references. Thank you.